11 years ago, I was diagnosed with breast cancer. I couldn't understand how I could miss it because I did everything. And after the initial shock, I thought, Angela, pull yourself together because cancer can be treated, can be cured, can be killed, and you can live. It all depends how you use the time and your strength. And I decided to fight it. And I came to Barts. I think it was the luckiest day of my life.
My breast cancer experience at Barts was difficult for me because I had a lumpectomy for a small amount of calcification, and then it was discovered that the disease was more extensive in the breast, and so I had to have the mastectomy. So for me that was more difficult because it was a drawn-out experience, although it was a very early stage breast cancer.
Once you've been diagnosed with a breast condition and require surgery, we can do it here for you. It may be just a simple lumpectomy, but you may require more extensive surgery such as a mastectomy. It is not good news, obviously, to require mastectomy, but we can also offer reconstruction.
The plastic surgery team works in close conjunction with the breast surgery team. Our primary role is to reconstruct the breast after mastectomy. One of the ways in which we do this is to use what's called a free tissue transfer. This is where a part of the patient's own body is used as tissue to reconstruct the breast after mastectomy. The most common area we take this tissue from is the abdomen. And whilst the surgery itself is quite complex and requires what's called a microvascular surgery, where the blood supply, a new blood supply is established to the reconstructed breast, it is done approximately 50 times a year in this hospital and is really becoming the gold standard of care for breast reconstruction.
Hi, my name's Nazma Sheikh and I was diagnosed with breast cancer first time 6 years ago. They removed a lump, called a lumpectomy, and then I had radiotherapy and chemotherapy. I did lose my hair, but as you can see, it's all grown back. And then about 12 months ago, I went for my regular annual mammogram, and there they spotted some more cancer. So I had a mastectomy, removed the entire breast.
So nothing to report?
No, thankfully.
Well, the good news is that everything's completely clear. The operation was a success and you don't require any further treatment.
Okay, that's amazing. Thank you. Thank you so much.
No, it's my pleasure. So moving forward from now.
In the breast unit, we have both medical and clinical oncologists who will then treat your cancer medically, either before or after surgery.
When the patient comes to the radiotherapy department to start with, we will do a CT scan to help plan the treatment. And then the treatment will start about a week later. You will need to come up to the hospital every day, Monday to Friday, for about 3 weeks. And you're likely to be in the hospital for 20 minutes each day. We have special techniques now that we use to make radiotherapy safer, particularly patients that are having radiotherapy to the left side of the breast. We know that this is very associated with radiation to the heart, and we have special techniques which we use to reduce that radiation by just treating patients when they take a deep breath in.
For me, radiation was almost enjoyable. I would bike there every day. I didn't really have any side effects. Decisions like radiation were taken more for the fact that I had extensive DCIS than the fact that I had invasive breast cancer.
Medical oncology entails treating patients with breast cancer with drugs, which could be in the form of chemotherapy, in the form of hormone therapy or endocrine therapy, or targeted therapy or biological treatment, and immunotherapy, which is currently in clinical trials. Clinical trials are very important for us because before a drug comes into clinical practice, it has to go through a process of clinical trials.
We have a very active research unit and we participate in many clinical trials. So you may also be eligible for some novel treatment. And again, we will be discussing those with you when you are seen in clinic.
Every time I'm feeling emotional and unstable about what's happening to me, I can call up Hannah or Jackie and just talk it through.
My role as a breast care nurse is to support women and men who come to the breast unit. And the way we do that is by acting as a key worker and acting as a point of contact. So patients can actually email us, call us, text us, or we can arrange a visit for them to come and have a one-to-one chat as well. We'll be there from the first visit, which will normally be the diagnostic visit, and we'll be also there throughout the whole, what we call pathway, the whole patient journey. And we are really there to support with information regarding diagnosis, treatment, and helping management of side effects.
If you've had treatment with us, you will also be hearing from nutritionists and physiotherapists as well.
With breast outpatients, we tend to see people after they've had a surgery and sometimes after other treatments as well, such as radiotherapy. We see them as a one-to-one, see them in our clinics, and they come in generally after they've had a surgery with limitations to their movement and if there's any other problems. We always encourage everyone to follow the post-op exercise booklet and any advice that the surgeons give. Sometimes it can be difficult though to regain range of movement afterwards, and that can be due to cording, muscle tightness, swelling and changes in sensation. We also advise people on returning to work and returning to activities and hobbies which they enjoy.
Open access follow-up is a new way of following up patients where they don't attend hospital appointments. We give them a dedicated helpline to call for advice and support if they have any new symptoms or any side effects from any medication they're taking, and we can give them advice on how to manage those. We see the patients at the end of their treatment for an hour and we give them all the information about managing their side effects, what symptoms to look for signs of recurrence, and we also give them the helpline number. They attend for a yearly surveillance mammogram and we contact the patients after that appointment to let them know the result of the mammogram. They're still going to be under us for the next 5 years of their follow-up and they can call us at any point during that time.
People say, oh, Angela is cured. No, Angela had breast cancer and she has to be aware because once you have it, it might come back. And you have to be very aware, do the exploration, to check your breast, take care of your breast, but you have to go through your mammograms and follow your instinct. Breast cancer is a sickness, like any other sickness. It depends how you face it, how you treat it. And breast cancer is not the worst thing that can happen to a person.